Hello, everyone. We will be beginning in just a minute. Okay, well, I'll go ahead and start. All right, so hi, everyone. Thank you for attending our webinar today on counting the kicks, which will be facilitated by Jennifer Roray and Erica Eichen. My name is Karina Kaliba, and I am the Vista Educational Program Associate with Healthy Mothers, Healthy Babies Coalition of Georgia. And today I will be the moderator for the talk as well. So just a bit on our organization, Healthy Mothers, Healthy Babies, or HMHBGA, has been around since 1973. Our mission is to improve maternal and infant health through advocacy, education, and access to vital resources. So we accomplish this mission through advocacy and collaboration with Georgia lawmakers and by serving Georgia communities in several different ways. So we are very excited for Jen and Erica to lead our session today. I do ask that you will familiarize yourself with the question box, which if you have any questions, you can write your questions in that box. And towards the end of the presentation, we'll have around 10 minutes, which we will answer any questions you may have. So with that, I will turn it over to Jen and Erica.
Well, hello everyone, and welcome today to our presentation on Count the Kicks. My name is Jen Rowry, and I'm going to go ahead and turn on my video here. And Erica, you can do the same. I think for introductions, that's a nice feature. And so I am the Director of Advocacy and Engagement for Healthy Birthday, Inc. And really what I do is I work on partnerships like this with the wonderful organization of Healthy Mothers, Healthy Babies. We are working in conjunction with the Georgia State Health Department and Georgia Strong Families, and we are super grateful for these partnerships because they are really working in the areas and the communities and with the expectant parents in Georgia to get babies here safely and to improve birth outcomes. I came to this work after experiencing stillbirth from a distance. A neighbor of mine lost a daughter, Grace, to stillbirth, and it was a highly impactful time in my life. And as this story unfolds, she became a founder of the organization I now work for many years later and had continued to work as a supporter of that before actually being employed. What I can tell you is that was impactful in my life, and it's going to be impactful in the lives of many others because really stillbirth is a topic that needs to be discussed. Then we need to shine a light on it, and we need to do our best to prevent it. And stillbirth is preventable, and that's what I've learned from that story of loss that's led to saving babies all across this country and in Georgia. I am so grateful to work with amazing volunteers across the country, including Miss Erica Eichen, who is here today representing your great state as the Georgia ambassador. And I will go ahead and pass that to Erica and allow her to introduce herself.
Hi, everyone. I'm so grateful that you're here today, and thanks, Jen, for being here as well. So I'm a mom. I'm also in the state of Georgia with you guys. I am the ambassador to Count Kicks within our state. I have 3 children, and unfortunately, what brought me to Count the Kicks is not a happy story. It's a sad story. My second daughter, Alexandra, was stillborn at 33 weeks. And let me tell you, I was textbook a normal, healthy pregnancy. There were no complications, nothing was wrong. She and I were both completely healthy. She got a true nut in her umbilical cord, and it tightened all the way, and she didn't survive. And when I tell you that losing her broke me, it did. Um, it wasn't until after I lost my daughter that I came to realize the importance of movement tracking in the third trimester of pregnancy. And I was very fortunate to get in touch with the lovely staff at Count the Kicks at Healthy Birthday. And, from that point on, I became educated. It is so important to track movement in the third trimester. And I often wonder if I had known about this during my pregnancy with Alex, she might be here today. And that's something I have to live with forever. So if my work for this amazing organization can help other parents become empowered to know about the importance of movement tracking and to save babies' lives, then Alexander's life was not in vain. And I'm so proud to be here talking with you today.
We're so grateful for you, Erica. I will go ahead and turn my camera off and we'll just continue the presentation. So I'm going to attempt to share my video and hopefully this goes well. This is a great video that just highlights the organization, the work, and the importance of kick counting. If you listen to the story, it also highlights the power of mom-to-mom storytelling. And you will listen to the story of a baby that was saved by a mom who was educated and empowered to speak up. So we will give it a try here. Bear with me as we work through this new technology. So that is a wonderful story, but it also is a life-saving story. And I want you to take note that we're going to talk a little bit more about movement as we continue this presentation. And we actually do have stories that came as a result of Emily's saving Ruby. This story actually led to at least 2 or 3 further baby saves that we were made aware of. So we also want to highlight the movement changes, and we'll reference this video again as we move forward. So what is Count the Kicks? Because that's what we're here to talk about today. Count the Kicks is a highly effective, evidence-based stillbirth prevention campaign. It was developed as an early warning system for moms that is currently saving 1 in 3 at-risk babies in Iowa. Our
Jen,
campaign.
if you want to share your PowerPoint, we still see the YouTube screen.
Oh, so sorry about that. I'm not sure. This is the technology. Let me,
There
how about that?
we go. Good job.
Perfect. Thank you, Erica, for letting me know that. I apologize. So the campaign is ready to go and it's low cost. In fact, in the state of Georgia, due to these amazing partnerships with the state health department and Georgia Strong Families, we can offer you almost all the resources that we're going to talk about later in the presentation for free. And so it doesn't get much easier to access than that. So I think it's important to level set what we're talking about. When we use the word stillbirth, we want you to understand the definition of that. And so a stillbirth is defined as the loss of a baby after 20 weeks of pregnancy and up to that 40th plus week. So there really are categories of stillbirth. And so a miscarriage would be that 20 or 19 weeks and earlier. Stillbirth 20 to 40 plus, a baby that takes its first breath in this world and passes by its first birthday is a part of that infant mortality discussion. And so we actually lose more babies to stillbirth in this country, over 23,000 annually, than we do to infant mortality, which we do hear significantly more about. And we lose at least 10 times more babies to stillbirth than we do SIDS. Again, we hear a lot about SIDS and infant mortality, as we absolutely should. We want to save babies at all stages, but we need to be hearing more about stillbirth because then we can find solutions. We can educate, empower with programs like ours, and we can create solutions because stillbirth can be preventable. So by the numbers, this is the national average. So every 1 in 169 pregnancies actually ends in stillbirth. This is something that Erica and many of my ambassadors and other expectant parents across the country have told us that they had no idea. Had they realized how serious of an issue this was in our country, perhaps they could have been given the resources they need. We all need to be talking about it. Unfortunately, because of the unjust system that we live in and the persistent racist culture that we live in, those racial disparities exist and persist with stillbirth, much like they do many other health issues. So a Black expectant parent is at risk more than 2 times more at risk, and in the state of Georgia, higher than that because southern states have higher disparity rates, and they are more than 2 times at risk to lose their baby to stillbirth, which is completely unacceptable. So every 1 in 96 pregnancies actually ends in stillbirth for a Black expectant parent. For Hispanic expectant parents, that's 1 in 199. For Indigenous, 1 in 138. For white, 1 in 204. Asian Pacific Islanders experience stillbirth in 1 in every 233 pregnancies. So talking about your state and looking at that, if you start in the top right-hand corner here, or I'm sorry, left-hand corner of the screen, you will see that the stillbirth numbers for Georgia, and really the rate is quite high. It is the national average is 5.95%, so or 5, which would be almost 6 babies per 1,000 in this country are lost to stillbirth. The rate in Georgia currently is 8.02, so just slightly over 8 babies per 1,000 are lost to stillbirth in your state. You can see this graph. The red line is Georgia. The national average is the blue line. And we have the state of Iowa, where our campaign was born and has been here long enough to see that 32% reduction we want to bring to Georgia and to the entire country so we can save babies. So on average, Georgia loses sadly 1,041 babies a year. That's a lot of lives that are impacted because we lose that baby, and that impacts a family, that impacts a friend group, that impacts a community, that impacts the care team that delivered that baby. The ripple effects are lifelong and broad. We could, if we saved 1 in 3 at-risk babies in the state of Georgia, which is what we're here to talk about, we could save 333 babies. So this conversation is highly important and could be highly effective. So talking about Iowa, so as I mentioned, this is where the campaign was born. It was born, as I referenced a little bit earlier, out of loss. And so there were 5 central Iowa women who lost their daughters to stillbirth and 1 to infant mortality in the early 2000s. And they came together through friends and pastors to grieve together, really, to support and lean on one another as they had that shared lived experience. what they discovered in the questions that they had and the commonalities of their story is that they were all told that this just happens, there's nothing you can do about it, and they realized quickly that those answers weren't good enough, and they wanted to be more of a solution. They wanted to gather data, and so they created the first stillbirth registry in the country, in the state of Iowa, to collect that data, to know what was happening, why were we losing babies, how many babies were we losing, because if we don't understand the problem or the prevalence of the problem, it's impossible to come up with reasons why it's happening and therefore solutions to those problems. And what we have found, as you can see in this chart, is that Iowa has been highly successful. So the soft launch of Count the Kicks happened in this 2008 timeframe. And we can see this dotted trend line that reflects Iowa's stillbirth rates, where we currently have the second lowest stillbirth rate in our state history. So the inception of Count the Kicks, in the first 10 years, we saw that 32% reduction of stillbirth, and we saw a 39% reduction in the rate of stillbirths amongst Black Iowans, and we want to see that continue, and it has. You can see 2020 is here, and 2021 we actually saw a continued trend line down. So racial disparities, why are there such large disparities for stillbirth? And this is based on research studies that we pulled these contributing factors from. It points to systemic racism within our culture, within our healthcare system. We have work to do as a society to acknowledge this and to remedy it. That racism creates toxic stress, and that stress is just part of living in an unjust society that has led to pervasive health issues that literally create physiological changes to the DNA sequence. It's called epigenetics, that causes a predisposition to certain health conditions that make you at higher risk for stillbirth, like gestational diabetes, preeclampsia, or high blood pressure. All of this also is an issue when there's an access to health care. We know that prenatal care, even prior to pregnancy, is highly valuable and can improve birth outcomes. But when access to health care is blocked or not easily accessible, what we find is that expectant parents are accessing those resources by, maybe as late as the third trimester, and that is completely too late. So there are socioeconomic barriers. Poverty is a risk factor for stillbirth. One thing I do want to mention is research shows education is not a determining factor. A college-educated Black woman is still more likely to lose her baby than a high school-educated white woman. So we have work to do. Let's talk about that work. So Count the Kicks, our organization, Healthy Birthday, which is the 501(c) nonprofit that runs the stillbirth prevention campaign, Count the Kicks, actually has a health equity team. We are currently transitioning our health equity coordinator, who is amazing and wonderful and still working with us on contract, had to step away due to health conditions that her parents were experiencing and to support their needs. And so we are currently in transition, but looking to elevate that position, and we will continue to do that work as we need to with volunteers and contact track workers until that individual comes on. So we're hoping that will be soon. We are always looking for funding opportunities to reduce racial disparities that persist in stillbirth. We are an inclusive organization with 100% board and staff training on anti-oppression and structural racism. We look to improve programming based on the lived experiences of women of color. We hold focus groups. We work with organizations that are very much doing the boots on the ground outreach in communities that are being marginalized. Actually, I need to update this slide. I apologize. The app is available in 14 languages, not 12 languages. And that is important because it's knocking down barriers. So wherever we can, we're looking to knock down those barriers. We have culturally appropriate educational materials, and we have videos, printed educational materials, and our FAQs in multiple languages on our website. So where did this campaign, I said it was born, right? And it was born out of loss, but these intelligent women actually created that stillbirth registry in Iowa, which eventually led to a national stillbirth registry. And while at a conference in Washington, D.C., two of the founders, Janet and Tiffin, listened to a research study out of Norway, this particular research study, in fact, and they listened to the importance of educating expectant parents to track their baby's movement in the third trimester, learn their baby's normal, and to speak up when they noticed a change. In fact, Dr. Ruth Fretz from the Harvard Medical School, who was a practicing OB, was a part of the study, and she continues to be on our influencer advisory board. What this study, the results of this study showed is a 30% reduction in the stillbirth rate in the cohort of expectant parents that were educated on movement tracking in the third trimester and empowered to speak up, and had a care team on the flip side that listened to their concerns and made sure to evaluate that information. And so Dr. Fretz has this powerful quote that I would love to read. Tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health in the third trimester of pregnancy. Babies can be saved when expectant parents are educated on getting to know their baby's normal movement pattern starting at 28 weeks and to speak up if they notice a change. Count the Kicks has been named a best practice by the Association of Maternal and Child Health Programs. That was a thorough scientific review. The reason this organization is important is it oversees the maternal and child health programs at state health departments. It's a membership organization for those state health departments. The CDC lists movement as one of the 15 urgent warning signs for a pregnant woman to pay attention to and to speak up about if they notice that change. One thing that we hear is, I don't want to create anxiety in moms. And we understand that. We don't want to create anxiety in moms either. So we actually had a study done on our app users, and a survey was sent out. And there are other studies that are listed. Each of these slides have links to the studies if you're interested in learning more. And you can always find more information on studies, by the way, at www.counttthekicks.org in our evidence tab. But what this study did was kind of evaluate that anxiety issue in women. It says one potential side effect of routine monitoring of fetal movement could be an increase in prenatal visits, either outpatient or in hospital. However, most research has not found this type of increase to be true. Usually, the fetal movement count is reassuring to pregnant women and prevents unnecessary visits. In fact, 77% of our app users in this study actually reported feeling less anxious. And if I were to let Erica pipe in here, Erica, if you could speak to this in your rainbow pregnancy, that pregnancy after loss, and using the Count the Kicks app, that would be amazing to hear.
Absolutely. So after I lost my second child, Alexandra, to stillbirth, I got pregnant again pretty quickly, which I realized I'm very fortunate. And at this point, I had become educated on the importance of movement tracking. So I used the Count the Kicks app religiously during my third trimester of pregnancy with Cal. I counted every evening around the same time. And I will say at the very beginning, Jen, just in full honesty, it did make me a little bit anxious just because of my past experience. But I would say within a week of finding his regular patterns, Calvin had a very regular, I would get 10 movements usually within 10 to 15 minutes. And having that information, knowing that he was consistently moving in the same patterns and around the same strength and stuff like that, was incredibly empowering, and it actually alleviated a lot of my anxiety in the long run.
Thank you for sharing that, Erica. And what we know is that the other benefit of tracking movement that came from this study is that 84% of our app users actually stated that regular tracking was associated with feelings of bonding with baby. There's a win-win. Not everyone is going to experience a baby in distress. So if they monitor movement and the result is bonding with baby, that can help in that postpartum bonding. It can help eventually reduce childhood ACEs, adverse childhood experiences, because that bond between parent and baby is vital. So we are here to tell you that we actually believe that this is a tool for everyone to be using during their third trimester of pregnancy, and that we believe, based on the information in this study and the anecdotals from Erica and many other others that have lost babies, that it actually perhaps prevented their anxiety from taking them to the doctor or the hospital unnecessarily as well.
I completely agree. And then speaking to the bonding part of it too, I should have mentioned this. It was actually really funny because after Calvin was born, I found that his awake times were really in tune with like when he was more active in my belly too. So it really is a cool way to get to know their little personality, even before, they're here in the world with us. So it really is just a great bonding experience, and as well as, an empowering tool to make you feel confident that your baby is okay.
And it's an experience you can share with another parent, a partner, with siblings perhaps, where they can help you be a part of that kick counting. I just saw a story where a mom used her baby was active at her toddler's bedtime, and so during story time they would read a story, but they also had the app out and they were counting the kicks and talking about that new sibling that was on the way. So maternal fetal movement monitoring does have additional benefits. Reduction of preterm birth rate, for example. There's a story, actually, our own executive director at 30 weeks pregnant was educated on movement, knew it was important, noticed a change in her son's movement, spoke up. Again, she was 30 weeks gestation, so baby would be very early to be born at this point. Unbeknownst to her, she was in preterm labor, so her body was trying to deliver him 10 weeks early, which was dangerous for baby. So because she noticed this change, she spoke up. Doctor had sent her to be evaluated, found she was in preterm labor, and they were able to put that labor to stop because of early intervention, medication, bed rest, etc. They were able to stop that preterm labor, and her son was born in the 40th week, completely healthy, never spent a day in the NICU. Other things with fetal growth restriction, for example, if a baby's not getting what they need and they're going to slow in their growth, but they're also going to show a change in movement. They likely are going to slow down as their distress increases. And so we could potentially be having a mom notice or an expectant parent notice that movement change early enough that doctors could be investigating. The medical team can be investigating and may be able to identify that risk factor for stillbirth even earlier. We just released a white paper on the ties between stillbirth and maternal morbidity and mortality, actually, and I'll share that link with Karina. She can send it out to our participants if she would like afterwards. But we know that women who deliver a stillborn baby are at 4 times greater risk of suffering a severe health issue, maternal morbidity, and or loss of life, maternal mortality themselves. And there is a link between stillbirth and maternal mortality. Let me give you an example of this. So there's a Baby Save story that we received out of the state of Ohio. Mom, fourth time pregnancy, or fourth time mom, so she is very experienced with pregnancy. She is a nurse practitioner herself, so pretty high health literacy, and access to care was not a problem. She notices late in her pregnancy, in that 37, 38 week mark, that baby's movement has changed. And when she woke up that particular day, she noticed that she didn't have quite the zip. She felt a little bit off, but nothing alarming or concerning to her. She just chalked it up to being tired. She was at the very end of her 4th pregnancy, had 3 small children, a full-time job, and so really didn't think much of that feeling off. But what she did notice was that change in her son's movement, which triggered her to call her provider and have that investigated. And when they investigated, what they found was baby was responding to mom's health issue, which was a severe spike in her blood pressure, a situation she never faced before, an experience she never faced before. And so she was at risk of a stroke or other potential health consequences herself. And baby was actually the alarmist in that case. It wasn't mom's symptoms that alerted her. There are so many research articles. As I mentioned, go to www.countthe.kicks.org and reference all the information on fetal movement monitoring and the studies that influence the work that we're doing, because we do believe that's powerful. It's important. We are an evidence-based campaign. So that implementation of Count the Kicks is what we're here to talk about. So now you know the history, you know why it's important, the evidence behind it, you know what stillbirth is. Let's talk about using this fetal movement program called Count the Kicks. Erica, do you want to take it away?
Sure, thank you. Let's really dive into what the app is and how to use it. So we all know Count the Kicks is a stillbirth prevention public health campaign. It's evidence-based, which is great. The doctors like science, but it's also very mom-focused. It educates women on the importance of tracking their fetal movement in the third trimester. We have our mobile app, which is the easiest way to track your movement. But for those who might not have a smart device, we also offer paper charts via the website. And Count the Kicks empowers moms to speak up to providers if there is a concern. We all know how sad and hard stillbirth is to talk about, and I'm here talking from firsthand experience. But what the founders wanted to do is create a campaign that would easily allow providers to talk about stillbirth and prevention of stillbirth with their patients, and for expectant parents to understand what's normal for their baby and speak up if they do notice a change. So let's talk about the actual app. It is free. It's available in 14 languages, and we're always adding new ones. It's available for both Apple and Android devices. If you're doing a session and you get interrupted, I know that happened to me a lot. I have an older daughter, so when I would be counting kicks, if I got pulled away, I would just restart my session or delete a kick if I accidentally hit the button when I wasn't supposed to. And you can even set a daily reminder so you get prompted by your device to count the kicks. You can go back and review your kick counting history. You can download that history and share it with your provider. That's so important. You know, if you say, I noticed a change in my baby's movement, here's the data. This is really happening. A newer feature too is that you can count with twins. So you can track for each individual baby. And you can track future pregnancies on the same profile. You don't have to create a new profile if you're pregnant again down the line. And you can also manage multiple devices registered to your account. We also offer this app on Apple smartwatches now. Next slide, Jen. Okay. So Count the Kicks now has a new strength tracking feature, which is really important because not only do we need to pay attention to the fact that baby is or isn't moving, but the quality of the movement matters too. Think about it. When you're sick and you're not feeling well, what do you want to do? You want to go lay in bed. You're lazy because you don't feel good. Same with baby. If baby's not feeling good, if something's wrong and baby's in distress, they may move, but they may not move strong like they're used to. So you can rate the strength of your baby's movement from level 1, which is fluttery, to level 5, which is really strong movements. Like you think a limb's trying to poke out through you, a la Alien movie, and the whole belly may actually rock from side to side. You can put notes at the end of your kick tracking session. Baby felt strong like normal. And then you can always go back and look at the changes in movement patterns. So on this third little depiction here, you can see baby normally hit their movement patterns within this similar amount of time. And then on the most recent date, it took them much longer to move. And then if you look at the movement strength that coordinates with that, you can see it wasn't as strong as normal. So this would be a very obvious indicator that mom should get checked out. Something was different with baby. The Count the Kicks app now has video capability to help educate users. So you can actually click on that side menu panel and it'll take you straight to educational videos about how to kick, why it matters, stories of other people and why they use the app. So there's a lot you can access right from the menu there. So another link you can find via the app, it will take you to the Healthy Birthday Find Help page. And this is great. You can put in your zip code where you live, and it will give you all the different kinds of resources you might need as an expectant parent on, you know, housing, food, transportation, the list goes on. But this is a newer feature, and we recently launched this resource on our app. We keep updating this, so you know, if you notice something's missing, you can always let us know and we'll add it to the list. Now let's, are we gonna watch a video, Jen, to see just how easy using Count the Kicks is? Yes, we are.
Yes, I'm gonna give it a try. Let's see if we can get it to roll. Are you seeing the video, Erica?
I think I see your screen. It doesn't look like it's wanting to play.
It doesn't look like it's going to load. Again,
You got it, Jen. It's coming.
it's coming. Okay, it's not
Yeah,
showing on my side, so that might be a problem.
thinking. Give it just a moment. Well,
Let's just maybe go back in. Do you still see my shared screen?
I see the video trying to load. It's got the little circle that goes around and around.
How about now?
Now I see your screen, your PowerPoint.
Wonderful. So I apologize for that technical difficulty. We will share the link to this video. It shows you how to use the Count the Kicks app. I do love the video because it's quick, it's clean. It shows you how the app uses that tool during a kick counting session. So we will share that link to that video. One thing I want to point out here is that the app is a data download of mom's intuition. So we don't want mom to not listen to her gut. We want mom to trust herself and trust her instincts. And this is a tool that comes alongside her and just helps her trust herself. And it gives her the confidence she needs to have a conversation. I think one of the reasons it's so important, especially for marginalized communities, to have this tool or resource is it changes the conversation in the room with a provider. The change is this. Instead of saying, I feel like something's off, which is really hard for a clinician, they have a lot of investigating to do, right? And there's an emotional word tied with that. I feel like, well, what does that mean? What does off mean? What's your baby's normal? There's a lot of questions there and a lot of investigating, and mom may not necessarily, if she's not tracking movement, know the answers to all those questions. A mom who's using the Count the Kicks app or an expectant parent that's using the Count the Kicks app has this amazing tool in their hands. They literally can text the data, so they can show that data to a provider, email it, or they can hold it up in their hand, for example. But this is where the conversation changes. Mom says, I know my baby's movement has changed because my baby's normal is to get to 10 movements in 10 to 15 minutes. Today, it took my baby an hour and 45 minutes to get the same amount of movements. That's not normal for my baby. I'm concerned. My gut's telling me I need to speak up, and it gives them the confidence to speak up, but it also gives them the confidence to carry data into that conversation. And if there's a barrier, to remove that barrier by going around it, by asking for another care provider, going to a different facility, whatever that next step may be. But it is a powerful tool for clinicians and parents alike because they are informed conversations that make that investigative process so much more thorough and gives the ability to really determine what the next steps of investigation should be. So having the conversation on stillbirth is tough, but Erica would love to share some tips with each of you.
Yes, we all understand that talking about stillbirth is not something anyone wants to do, but it's really important. And I just wish someone had talked to me about it. Expectant moms hear all sorts of different things about that could happen to their baby. We're told to take folic supplements. We're told to not drink alcohol. We should be told to count our kicks. Like, it just blows my mind that everyone knows the SIDS campaign, back is best, right? And everyone should know that back is best. But 10 times more babies die from stillbirth, and not everybody knows count your kicks in the third trimester. It should be common knowledge. So let's talk about counting the kicks. When should you do it? If you're a typical normal pregnancy, you should start at 28 weeks at the beginning of your third trimester. If you're high risk or if you have twins, we recommend that you start counting at 26 weeks. So it's really easy. Since we weren't able to see that video, I'll just speak really quickly about how to use it. You log in, you hit start the session, you sit there, and every time you feel a movement from your baby, you're going to hit the button. So what is a movement? A jab, a roll, a push, basically anything you feel other than hiccups is counted as a movement. So over time, so you're going to hit that button every time you see how long it takes your baby to get to those 10 movements. Again, you want to try to do it around the same time every day if possible. For me, with my pregnancy with Calvin, I found the best time to do it was in the evening after dinner. He would get, pretty active around that time of day, and I think that's rather common for a lot of babies. So push that button every time you feel one of those movements, and then you find out what your baby's normal pattern is. This can be very different from baby to baby. Some babies are real active. You might get your 10 movements within 5 minutes. Others, might be a little more sluggish. They might take 30 minutes. But you're going to see a pattern develop over time really quickly. So once you notice pattern, if something is happening outside of the norm, that would be your indicator to talk to your doctor. And I think we already touched on how it can be a bonding experience. And as providers and caretakers, you don't want to scare expectant women during their pregnancy. But, just as I mentioned, pregnancy is full of risks. People are aware of this. Stillbirth is one of those risks that moms deserve to be educated about. Another thing we hear is stillbirth just happens. There's nothing we can do. But that is absolutely not true. There can be warning signs if moms know what to look for. In hindsight, I really do believe Alexandra's movements slowed down in the week leading up to her death. If I had been more in tune with that, if I had the data, maybe I would have gone into the doctor. Maybe she would be here right now. So, there is something we can do. We can use Count the Kicks. Her baby is always active. It's not a concern. Well, babies are active until they aren't. Cord issues and placental accidents can be very sudden. So moms need to know what's normal. That way they can spot a change. She's almost at her due date. Oh, we hear all the time that, when you get closer to your due date, the baby's going to run out of room. They might slow down because they don't have space. That's not true. The quality of the movement might feel a little bit different, but they're still going to move up until and even during delivery. And the data does show that the risk of stillbirth actually increases as mom approaches her due date or exceeds her due date. So it's even more important to count your movements the closer you get toward your delivery. Okay, so a lot of times we get questions about what to do or say when talking about fetal movement to moms who have experienced a stillbirth, moms like me. And I can tell you firsthand that we don't want to be treated differently than any other mom. Follow the same protocol. You should be having the same conversations with parents, regardless of whether they've experienced a stillbirth, regardless of whether it's their first pregnancy or fifth pregnancy. This information is important. It should be reiterated to every parent. So make sure that you keep it personal. Read their chart before they enter the room so you're not busy when they come in and you can interact face to face. It is statistically proven that women who have had a stillbirth are more likely to experience another stillbirth. So you might want to encourage a lost mom to start tracking at 26 weeks instead of 28. And, don't shy away from talking about her loss. My greatest fear is that Alexandra will be forgotten and that she won't matter to other people. So I love it when people say her name. I love it when people talk about her. I want to keep her memory alive. So ask about the name, the gender, if you weren't her previous doctor. Definitely stay away from medical terms like fetal demise. That sounds awful. Just be empathetic, be kind, be understanding, and talk about her baby. You can ask if anyone has ever talked about the importance of tracking fetal movement before. A lot of moms we talked to have stated that in their previous births, they were never told the importance of tracking fetal movement. I know that with my practice, I love my OB, and I stayed with her after I lost Alexandra, and she was there for my third Calvin's birth. But I do fault our healthcare system. I think we're failing as a system, and I don't blame any one individual doctor. But this should be something they talk to you about at every appointment. I would go in and they would say, "Do you feel movement?" And yeah, I feel movement, but that's not enough information. And we need to know consistency of movement, quality of movement. The questions need to be more specific. The doctor can pull up the app on her phone and say, "Here, download this app. It's a great free tool." Next slide, Jen, thanks. Okay, so we're gonna run through some common myths with you guys and why they are not true.
And we did address this one a little bit, so we'll real quickly just say my baby is always active, so I don't need to count the kicks.
Even active babies can experience distress, sometimes quickly and without other warning signs. Tracking your baby's movement every day takes the guesswork out of knowing if a normally active baby has slowed down. Count the Kicks gives you real data to show your healthcare provider if you have a concern.
Only those experiencing a high-risk pregnancy should pay attention to their baby's movement.
Not true. All expectant women should be educated on Count the Kicks and get to know what's normal for their baby.
And I will say that almost all the expectant parents I work with that have lost babies, including Erica, were in textbook pregnancies with 0 risk factors when they lost their children.
Can happen to anyone. It's really scary.
My baby should get 10 kicks in 2 hours.
Not true. Every baby's different. The recommendation to expect 10 kicks in 2 hours is outdated. Current research indicates moms should work to understand the normal amount of time each day it takes their baby to get to 10 movements. I feel like 2 hours is a really big window too. I think that most babies you're gonna get those 10 movements in well less than 2 hours.
And there is research out there about this being outdated if you want to go to our website and read it. I can just use a Doppler device to monitor my baby's well-being.
A change in baby's heartbeat is usually one of the last things that occurs when a baby's in distress. A change in baby's movement can happen much earlier and can indicate potential problems before actual changes in the heart rate are detected. Expectant parents should only use the Doppler device under the guidance of a healthcare provider. Not to mention that, where are you getting your Doppler device? Amazon? Is the technology current? I mean, you just can't really trust that. I really think movement tracking is a early and better indicator of a potential risk to baby.
If baby isn't moving, I should drink cold water or eat something sugary to get baby moving.
Research has moved away from the idea that sugary drinks and the like are a good way to get baby to move. Kick counts are best monitored without interventions like juice, candy, etc. If baby isn't moving like normal, parents should speak up to their provider right away.
Babies kick less near the end of pregnancy.
I spoke to this just a minute ago. Babies don't run out of room. Their movement may change, but they should move up to and even during labor.
Triage doesn't need any count the kicks education.
False. Labor and delivery triage is the perfect place to have this information. Posters, brochures, discharge papers, they should all be used when someone comes in for anything and is sent home. You need to let them leave with that knowledge. They should be tracking their movement.
So other ways to integrate, and I'm going to go through this part fairly quickly, but I have a variety of individuals on this audience. So you have to think about your system, your work, how you interact with clients or patients, if you're a patient yourself. So there are ways that this can be integrated easily into your system so that the conversation isn't missed. First of all, this conversation should happen every appointment in the 3rd trimester. So leading into the 3rd trimester, moms need to know about the app. They need to know about tracking movement. They need to know to be prepared to do that and to start doing that. But once they start, this conversation needs to happen every appointment in the 3rd trimester. We need to consider, do you have discharge paperwork in the organization you're working with, like labor and delivery triage or other clinic paperwork? Is there paperwork that post-visit summary, for example, that you can put this information into so that they know about kick counting and count the kicks and how to monitor and to speak up if they notice a change? Everybody on staff should be trained about the importance of fetal movement. So if a client or a patient speaks up with a concern, they know what to do with that. First, hours and minutes matter. They cannot be put in a call queue that doesn't return a phone call for 3 hours. They just simply can't. If an expectant parent has a concern and they're not getting a call back or they don't get directly sent to a provider, we encourage them to go directly to labor and delivery triage and not wait for that clinic system. So if you're in a clinical system, make sure that those types of phone calls are addressed quickly, urgently, and with the appropriate staff. You can include it if you're in a nonprofit organization or community-based organization in a family care or intake form. You can put a blurb about, or a paragraph about Count the Kicks. What about glucose testing? After that, could you have a nurse talk about the app, help the client download it, and use that time while they're waiting wisely? And if you have emergency medical records, if you use any type of electronic system where this could be incorporated, to make sure that there's an alert so that clinician is talking or that nurse is talking about counting kicks, or you're having a conversation with if you're a home health visitor or WIC worker or you're a community-based organization, to count the kick or to have that discussion. I'm just going to kind of go through this fairly quickly. This is an example of an after visit summary that a hospital system here in Iowa did. And you see that that's just a part of that after visit summary. It would be similar to the discharge paperwork. Where can you slide that in and make sure that whoever leaves with a concern has the information they need if they were to continue to have a concern? Having an ultrasound one day does not make that baby safe day 2. And so we don't want to get in the habit of turning off mom's instincts and her knowledge. And so we want them to count the kicks and to speak up if 4 hours ago everything was fine, but there is a significant change and concern. We want those expectant parents to speak up. It's better that they speak up, and I believe that the nurses and clinicians would agree. They'd rather have a mom speak up than to quiet her concerns and have an adverse outcome because of it. Another example of that intake form for a nonprofit in Ohio called Celebrate One. Additional Georgia resources. Erica, do you want to talk about this? Erica, are you there with us?
Sorry, I was muted. I was just talking to myself.
It happens.
So our free app is obviously the hallmark tool to help educate and empower expectant parents to track their baby's movement. However, our #1 resource for providers and organizers are the free Count the Kicks educational materials. These materials are free because of funding by the Georgia Department of Public Health and Georgia Strong Families, and they're ready to be ordered today. We're really excited about this. This step of getting funding from the state happened last year, and Jen and I were both a part of that. So we're just really excited that you guys can actually go to our website. You can download promo posters. We have them in both English and Spanish. How-to posters. There's little app reminder cards, brochures. And again, did I mention this is absolutely free? So all you have to do is go order them. They even ship to you for free. I have app cards that I carry in my wallet, and I am totally that crazy person who, if I see a pregnant belly, I will go up to a total stranger in the grocery store and say, hey, have you heard about Count the Kicks? Here's a card, check it out. But this is just an incredible resource that I'm so excited we have, and we really want to encourage you to take the time to either use this QR code that's up on your screen or go to our website and download these, or not download, order these free materials and have them shipped to you today.
That would be amazing. And take note of the colors. So it was really important to our founders to not have a fear-based campaign, that this was supposed to be empowering, educational and empowering, to give the tools and resources to moms and providers that they need to help improve birth outcomes. And so it's very mom focused, as you notice. It is not medical. It is not scary. It is direct and easy to understand. In some states, we also have picture-based materials for those non-English speaking populations. So it is in Spanish and English as well, the materials that you can order on our website today. Nothing would make us happier is to see orders come in as a result of the conversation we're having. Zero risk. Hang these posters in your waiting rooms, hang them in public spaces, at libraries, in community centers. Make sure that it's visible. We actually have baby safe stories out of this where it was posted at the scale, and mom had looked at that poster, decided to download the app, and that's what cued her to a change in her daughter's movement and got her baby here safely. The brochures are an excellent educational tool to walk through and talk to a mom about. Remember, you may not have access to them throughout their entire pregnancy. So when you do have access, include these printed materials. right? Get them in the hands of expectant parents whenever you have access to them. If you're in a system where you have access throughout the entire pregnancy, make sure that conversation doesn't stop with the welcome to being pregnant packet at your 12-week appointment or your first trimester appointment, and it's never talked about again. And so although that's important that they have access to that tool, you need to re-highlight it later, closer to that third trimester. So CE trainings, Erica, did you want to tell them about that?
Sure. So continuing education courses are another thing that we offer through Count the Kicks. And the purpose of this educational activity is to train healthcare professionals about how to talk to their patients about fetal monitoring and using best practices to track fetal monitoring. You can use an evidence-based and non-invasive tool, Count the Kicks, and with this information, you can help prevent stillbirth. So the low-cost training can be accessed via this link, which I think Jen is going to send everyone the PowerPoint after the conclusion of this webinar. But it's a great resource and it is very informative.
And we actually just
we also get 1.5 credit hours, right?
Yeah, actually, we just made an update to this. So we literally just in the last week have updated this to be a 2.25 credit hour training. And it is low cost. It is actually now no cost thanks to the relationship with the Department of Health. So I will share the code, Save Babies code, for you to use if you want to access this free training.
Other free resources that we offer are our Parent Academy, so it's resources directly for expectant parents. Provider Academy, again, same thing, just for medical providers. We offer kick counting charts in multiple languages that you can download and print if you don't have the app on your phone. And of course, there's those educational videos that anyone can access via the app or the website.
Perfect.
I think this is just a sample lesson plan for childbirth educators. These are an example of some of the resources that we can offer you guys.
It's free and downloadable off of our website as well.
So I want to tell you about Count the Kicks ambassadors because I am the Georgia ambassador for Count the Kicks, and I'm so proud of this. We are all women who are volunteers, and we're passionate advocates due to our own personal experiences. We range from doulas to lost moms to moms who had their baby saved because of Count the Kicks. We attend a variety of events such as medical conferences, baby fairs. We're happy to give media interviews. We want to work to grow partnerships within our state to fundraise for Count the Kicks and to help save babies. That's what I'm doing here in the state of Georgia. And I would love to connect with you guys. If you ever want to reach out to me, there's my email, georgiaambassador@countthekicks.org. I'm an open book. I'm happy to share my story. I'm happy to give presentations, whatever you need from me. If you have questions, anything, if you know a lost mom who needs support, I'm your girl.
Awesome. And the reason we're here today is this. We know everybody in the room wants to make sure babies get here safely. And here are just a few of the baby safe stories that we've received. Again, if we could save 1 in 3 at-risk babies, which research indicates not only just on our research on our campaign, but research across the world indicates that at least a third of stillbirths are preventable, and much more research indicates even higher numbers than that. And so we want to get these babies here safely. Here are a few of those beautiful faces, and that's why we're here today. So next steps, familiarize yourself with that Count the Kicks app. No matter who you are, download that app, learn how to use it, and share it with others. Practice, practice, practice. Again, nothing would make us happier is that for you to get these resources in the hands of expectant parents as soon as possible. Go to www.counttthekicks.org and get those materials sent to you. They should be there in a couple of weeks or less. Take 3 to 5 minutes to make sure you educate. Share this information. It's not meant to be kept to yourself. Where do you interact with those clients, those patients, with others? Who can you share this information with? Other expectant parents, for example. Make sure your entire staff knows about the campaign and the importance of tracking fetal movement. Use those electronic records, those discharge paperwork, those intake forms, etc., to make sure that this education and information is everywhere that it should be. And remember, hours and minutes matter in preventing stillbirth. Make sure that you're a tool, a resource of education so that we can expedite those concerns and get that baby here safely. And we would love to save babies for you. I know we went right up to the end of the presentation, but we're here to answer any questions you may have. We'll stay on as long as you want to stay on, and help make sure that there's clarity to any questions you may have. We again are grateful to Karina and the Healthy Mothers, Healthy Babies, and again to the Georgia Department of Health and Georgia Strong Families Healthy Start programs for this opportunity.
And guys, connect with us on social. You can find us on Facebook at Count the Kicks. On Instagram, we're Count the Kicks US. On Twitter, we're Count the Kicks US as well. And you can find all these links via the website, counttthekicks.org.
Wonderful. Karina, do you have anything to add?
I see that there is a question from Kimberly. She did say this was a great presentation, and thank you, Erica, for sharing your personal story. Will you be sending this PowerPoint out to the group? Yes, I will be sending out an email to everyone that have attended the presentation today, and it will include a link to a survey, and then also the presentation will be attached in the email as well. Are there any other questions? Does anyone have any other questions?
Thank you guys for being here. It really matters, and it means so much to moms like me to know that there are advocates out there who want to help empower other expectant parents and save babies with me.
And thank you, Erica, for sharing that story. It's always powerful, and it shows the power of women sharing with other women. So thank you.
Yes. Okay, well, I don't see any other questions. Let me just
If you guys
make
have
sure.
questions come up, feel free to reach out to me, to Jen, to any of us at Count the Kicks. We're always here.
Okay, well then, I guess this concludes the end of our question and answer session. But again, thank you, Jen and Erica, for such an incredible presentation. It was very, very empowering, and I can say that probably everyone learned a lot here, and definitely something that we can all apply to the work that we do in our own personal lives as well. So just like I mentioned earlier, a follow-up email will be sent out after with a copy of the slides, as well as the recording of the presentation and a feedback survey. Also, Jen, if you can just email me the link to the white paper that you had mentioned earlier so I can send that out as well.
Absolutely. I will send all the links and get those to you today.
Perfect. All right. Well, thank you, everyone. And thank you again, Jen and Erica. I missed the CEU.
Oh, I will share the link to the CEU training and the free code as well.
Okay, perfect. All right. All right, Tracy, so you should, that will also be included in the email as well. Okay, well, I hope everyone has a wonderful day, and thank you again.
Thank you so much.
Thanks for being here, guys.